What's up, guys? Brian back from the PT channel here to talk about when will Stephen Curry be back after the MCL sprain, grade 1 MCL sprain. So he'll be back at earliest 2 weeks, but I don't know if they're going to do that. So we'll look at the factors, what's going to play a factor in that too, and what it looks like. But he has a grade 1 MCL sprain, tear. It's kind of the same thing, but grade 1, which is good. There's 3 grades. It's the lowest grade on there. It's not that big of an injury on there. Just like the big injury is Derrick Rose here. Everyone knows about the left knee. Look at it right there. Tears, left knee, buckles in. Tears 2012, he tore it. He had meniscus surgery, I think, a year after that, and he hasn't really been the same player since. Now, Steph Curry won't really have that injury on there too. The ACL is far longer of a surgery, injury, recovery time. Takes about at least a year to come back to return to sport. So Steph Curry won't have that. He'll be able to bounce back faster than there. But look at the left knee as it buckles in on Derrick Rose, and that's a common sign of that too. Non-contact, non-traumatic on there. So left knee, ACL, it sucks for Derrick Rose. He was a great player at Memphis and in Chicago before he got injured. Hasn't really been the same player. Maybe he's not trusting the knee as much, or it might be having some swelling in there too. But that's just a look at the ACL injuries. That black box is where the ACL is. It's the anterior cruciate ligament. It tears. You got to have surgically to repair it. You're out for at least a year on there for that, especially for basketball. That's a look at the normal knee on there. You see the ACL, the medial collateral ligament on the inside there too. And here's Steph's injury. Let's look at that. So it's far different. He slips and bangs it, so it's not the same torsional in there injury, but he tears, slight tear, sprain, whatever you want to classify it as, same type of thing. Grade 1. There's 3 grades of the MCL. It's tear, sprain, and it's the lowest grade for him. So it looks like it's a worst time for it. There, slip and fall, but he should be back and reevaluated. 2 weeks, maybe 4 weeks on there too. So let's look at some factors on there too. So 2 weeks, you're 50% healed in the knee from an injury on there. So do you want to overstress the healing time? You don't want to overstress the factors. No. You want to look at the MCL ligament injury, first sprain degree, fibers stretched but intact, no increase in joint laxity. So that's in his favor. There could be some slight tears, very small percentage of the torn fibers on there, but it will heal. It's got blood supply, so it will heal, which is great. So he'll be able to be on the court faster than any other injury that he could have suffered. He's going to be living in the training room. This is him getting his ankle wrapped, but he'll be living with the trainers, getting that knee out, getting the swelling out of the knee. Ice, and more ice, 15-20 minutes on and off. Probably a good regimen of that to keep the quad from deconditioning, keep the swelling down so he bounces back with range of motion and strength. You don't want to lose any of that because it would be tough. It's a game-ready device. It's pretty awesome. It's got vasopneumatic compression with ice compression in there too. Helps get the swelling out great. I'm sure they're going to use something like that. Knee brace, knee sleeve, but depends on what they're going to use. He might not want something bulky like that, but it'll give us some support. Knee sleeve, again, might something a little smoother on there too, but giving some lateral stability. So it's just tough with lateral cutting and movement for it. MCL protocol, just a basic protocol that might happen. They might use some of those things just to give you an idea of what they're kind of going through, and depends on the classification of what they got there too. So Steph, you're going to be out at least 2 weeks. They're going to reevaluate you, so you're going to miss the next 2 weeks. Depending on where you're at in the playoffs and how they're doing, they don't want to rush him back. Hopefully the Warriors can do well without him, because they're going to need the other players to pick up the slack anyway. He might not be the same player, game or two coming back, but he's going to have to do some shoot-around stuff, some basic dribbling, avoid cutting for probably any amount of time until they could really test it. And that'll probably be the 2-week mark, so they'll do some dribbling, some shooting, some basic stuff in there. He's going to have to take it easy. Some basic shoot-arounds, some stuff there too. So it's a shame, but hopefully the Warriors win on Wednesday against the Rockets and move on. It could be the Clippers, where they had a bunch of injuries on there too. Chris Paul broke his hand, and Blake Griffin hurt his quad, so he's going to be out too. So the Clippers are going to be banged up. So we'll see who they're going to play, if it's the Clippers or the Trailblazers. But Steph's the man. He's an MVP on there too. He's a great player, so you don't want to rush him back. You want him for the whole career. You want to be him. The Golden State Warriors, the same caliber on there too. You want to win a championship year in and year out, but you don't want to rush him back. So 2 to 4 weeks, maybe 2 weeks, maybe the 4. So we'll see how he goes in the rehab. There's a lot of factors, but I'm sure the staff does really well with it. Post your comments below. Like, share, subscribe. Let us know, guys. And as always, thank you.